Thank you for joining the First Unitarian Universalist Church of Houston for our weekly online Ministers Forum. I'm the Reverend Dr. Colin Bossen, Senior Minister here. These programs are recorded each Monday and then broadcast or put online each Wednesday. Today, I'm joined by Dr. Kim Waller, a member of the congregation and Associate Professor of Epidemiology and Disease Control with the University of Texas Health Science Center at Houston. In the coming weeks, we'll be talking to community organizers, scholars, religious leaders, and others about how we can collectively address the grave health, economic, and social crisis we are facing. The purpose of these congregations is to offer members of our community and all who wish to join us online science-based resources and liberation-focused religious inspiration to get through these difficult and extraordinary times. For those of you who are with us for the first time, let me say a few words about Unitarian Universalism. We are a religious tradition that celebrates the possibility of goodness within each human heart, the transformative power of love, and the clarifying force of reason. We believe that we need not think alike to love alike. In these strange days, we hope that you find these forums to be a source of comfort and clarity. Dr. Waller, our guest this morning, has a degree in nursing science and a PhD in epidemiology from the University of California, Berkeley. She has 7 years hospital experience as a nurse and over 20 years experience as an epidemiologist. Dr. Waller, thank you for joining us. How have you been processing the grave forecasts publicized by many public officials and responsible journalists? The governor of California has said that without mitigation, 56% of Californians will be infected within 8 weeks.
Thank you for inviting me, Reverend Bossen. Yes, I think like everyone else in the nation, I've been watching the forecasts, which are very sobering. What I know as a scientist is that the models that we run they always contain a great deal of uncertainty. So these models that they are quoting right now in the news reports are run by a special type of epidemiologists, which are people that run models to forecast the spread of infectious diseases. But there's a wide margin of uncertainty in those results. I did not locate the study that the governor was quoting, but for example, if the result of that study was 56% infected in 8 weeks, there would be a range of uncertainty around that. For example, the lowest range might be 25% infected in the model, and the highest range might be 75% infected, and then 56% infected would be the most likely. But it's just a most likely. You asked me earlier, what is a model? A model is actually an equation, a pretty simple equation usually, where you have variables that are trying to predict an outcome. So variables on one side of the equation are trying to predict the outcome on the other side of the equation. And the variables in the models that they're running, I believe, are the distribution of age in a certain population, the degree of infectivity of the virus, which there's still a range that they're considering, and the household density of the population. Those are very common. But the model I looked at did not include the rate of smoking in that population, did not include the humidity of the of that particular geographical area. The humidity is important because in the wide family of coronaviruses, not just the novel corona, but all coronaviruses appear to do very poorly in environments that have high humidity. So in Houston, that's could potentially be good news for us. So I'm just saying that there are many different things that can throw a model off. This morning, Dr. Michael Levitt, a Nobel laureate at Stanford, was quoted as saying he thinks the epidemic will end a lot sooner than predicted. And he made a prediction in China that came true. Because his prediction for China came true, people are listening to him. Other people are saying we're reacting too slowly, we need to do more. I myself don't know. I'm admitting that I don't know. I'm not feeling like I'm not an expert in the modeling, so that kind of modeling. So I'm just going to recommend that we follow what CDC has asked us to do. That's why we have the experts. They made some tough decisions, and I'm going to follow what Mayor Turner of Houston is suggesting and hope for the best.
Well, thank you. That was a very helpful answer. And I do have sort of a follow-up, just maybe clarification that might be helpful, because like modeling, right, is like, it's a complicated thing that like a lot of people who are maybe watching this don't really understand or think about. So like I might try to explain it a little bit more, and then you can kind of clarify for people. But right, like in a model, we have what are called variables, which are like these things that we know some stuff about. And then we're going to use those things to try to like figure out what might happen in the future. Right. So the things that we might know something about are like how infectious the disease is, how many people are going to get it if one person has it, or how lethal it is. And as those variables change, then the sort of outcomes change.
Exactly.
Right. And so you really, it sounds very complicated to people, but like with these kind of simple models, what you're really doing is you're taking, in the model that the governor was using, something like, we think one person has a 70% chance of being infected if, they sort of run into other people, and that if, I think some statistics I've said are half of 1% of cases are, lethal. And so if no mitigation happens, then you would say in a group of 1,000 people, 700 are going to get it. And what is,
and those, let me just say a couple of things here. The death rate among people that are symptomatic is currently about 1.5%. And I think that's what it's going to be for the U.S. Now, obviously, if you look at Italy, they have more older people. So their overall death rate will be higher. So the more older people you have in your population, the higher your death rate will be.
Well, and they have a different way of living, which I think also potentially impacts them, because Americans are much more socially isolated to begin with, right?
I think somebody said they have a lot of multi-generational living, and if that's true, that's going to increase their transmission and their transmission to older folks as well.
So they're just some examples of like how different variables that you might put into a model are going to have a different outcome in terms of what we might think happens, right? And one of the things that's just so important about social distancing is that all these models are being run before we factor in things like social distancing and like what might
They actually did try to factor that in, but I thought their variables for it were pretty rough. Like how many people would go to school and how many people do this and that. What they did not factor in is how well people pay attention to this and how well each individual does the social. How well, they don't have any information on individuals, but how well as a society we are able to implement this. One thing I can say about Americans, I don't know if it's totally true, but we do have a reputation of being rather interested in cleanliness. So hopefully the hand washing is taking hold.
Good. So how is the novel coronavirus transmitted, and how infectious is it?
It is transmitted by respiratory droplet. And by that, we're talking about droplets of moisture that are released when you cough, you sneeze, could even be when you speak or when you sing. And those droplets can contain the virus. They don't last in the air very long. They can fall to the ground within a few seconds. And so if you're close to somebody when they're emitting these droplets, you can acquire the infection. Now, there's a lot of talk about acquiring the infection from touching surfaces, and that is a possibility. and they have found active virus on surfaces. The thing to understand about the coronavirus, though, is it has an envelope of lipid around it, fatty material around the virus, around each particle of virus. If that material gets eroded, as it does after a while in the environment, the particle is no longer infectious. And there's a lot of envelope viruses. This is an envelope virus, so it's not as hardy in the environment as, say, measles. So let's look at influenza, where we think every person infected with influenza will infect maybe one or two others. With novel corona, we think every person infected with it will infect 2 to 3 others. With measles, every person infected with it in a situation with no vaccine will infect 10 to 12 others. So this is not the most infectious virus known by a long shot, but it is more infectious than influenza and, of course, more lethal. So that's how it's transmitted, primarily by being close to somebody, droplet in the air, possibly also by touching a surface. Most of the people where we know how they got infected, mostly they're getting infected from household contacts, intimate partners, that kind of thing. That's mostly how people are getting infected. But there are a number of people out there, this is community spread, that we now know a number of people out there getting infected where they can't figure out how they got infected. And that's concerning. That's what they call community spread.
Well, we wanted to talk about what the symptoms of the coronavirus were for some clarity, unless you had something more you wanted to say about it.
Yeah, let me talk about the symptoms a little bit. CDC is putting out 3 symptoms: fever, dry cough, and shortness of breath. To me as a nurse, I mean, that's great, but to me, what I'm doing is I'm watching YouTube videos that people are posting who've recovered from the virus, and they're talking about their symptoms, which I find very interesting. And there really is a wide range in what they report. Somebody reported that the first thing was a fever for them, so it started with a sudden fever. Other people report 5 to 7 days of cold-like symptoms, runny nose, sore throat, fatigue. Fatigue is a big part of it, I think. Some people report diarrhea at the onset. So the reason this is important is because there are a lot of people reporting about 5 to 7 days before they get the fever. Mm-hmm. So any sign of a respiratory illness right now, I would suggest stay home. Any sign. A very interesting symptom was in the news yesterday. There are reports now that some people are saying their first symptom was that they lost the sense of smell. Now, we need to wait for some data on that. That just came out yesterday.
So what should you do if you develop these symptoms?
You should stay home. And one of the really interesting videos I watched was a man. He was describing all his symptoms. He was a very honest guy. And like a lot of people in the United States, he just kept pushing. He described, well, I got this symptom, was sort of like a cold. I just kept going. Of course, I had to keep going. And all the time he realized he had the coronavirus, but he didn't know it. And then he got another symptom. He felt a little better. He kept going. He felt like resting, but he promised some people to do something. He kept going. And then finally he was diagnosed with corona. So we do this all the time. We just push through our symptoms. And it's not a good idea. So regardless of whether your symptoms prove to be novel corona or not, if you rest immediately, you're going to recover so much faster. I think of it as the old phrase, a stitch in time saves 9. If you rest when you're starting to get sick, you're going to recover much faster and you're going to lose much less time out of your work. But people just push. They keep pushing and they don't rest. There are scientific studies that show that people who get adequate sleep before the infection comes through, people that are getting adequate sleep are much less likely to have a symptomatic infection. And it's also important to exercise. There's at least one study showing that that helps. And of course, everybody recommends that you drink fluids. If you get hospitalized, the first thing they're going to do is give you fluids through an IV and make sure you're well hydrated. So it's better just to hydrate yourself at home.
So what would you say we should be doing to prevent transmission just in general?
In general, I'm sure everyone's heard some of these things. You keep the social distance of 6 feet. You limit your gatherings to 10 people or less. We're holding virtual meetings. We're holding a virtual church service. Hand washing is very important. I thought I couldn't do it at first because it makes my hands dry, but somehow my hands have acclimated to it. And I think everyone's seen the videos where you show you how to wash your hands and cover every surface. Those are very important. It's very important to watch the video and get the technique of hand washing down. And then, of course, you stay home if you're sick or if you think you're coming down with something. Don't touch your face with unwashed hands. I think my greatest concern right now, and the people I'm talking to, is the lines of transmission between children and older adults over 60. My sister is in this situation right now. So she's living with her 2-year-old grandson and her daughter. And unfortunately, the way they have it set up, he needs to go to childcare. They're in a different part of the country, but he's going to childcare. And he is in a very small childcare, but I'm concerned about him giving the coronavirus to her. And they're taking some precautions, but I would be very interested in any solutions people have come up with that situation, because the former head of CDC, Dr. Thomas Friedman, came out a few weeks ago and said children are going to be transmitters, and especially the smallest children. They're going to be the hardest to keep their hands clean. They're going to be the hardest to explain, maybe you shouldn't be cuddling with grandmother and stuff like that. So I think those people are in a very tricky situation.
So Dr. Waller, you're both a nurse and an epidemiologist. What additional ideas do you personally have about how we can stay safe and avoid becoming infected? And what can we do to help flatten the curve and the epidemic curve so that hospitals are not overwhelmed?
One of my ideas is that we need to talk about sexuality at this time. It's very clear to a healthcare professional that sexuality between two people can transmit a respiratory infection, but I don't think it's clear to everybody in the population. And I think we need to put out there that it's not a good time to have a new sexual partner. It's not a good time to have a lap dance. Even if you're married and you're just trying to prevent acquiring the infection from your spouse, then you shouldn't be having sex at this time. I think if you just think about it, that kind of proximity would easily pass any respiratory infection at this time. The other thing I wanted to say is that the novel coronavirus, at the start, it's multiplying in the back of the throat. So that the test, they put a swab up your nose and down to the back of your throat, and it's multiplying back there for a few days, and then it moves to the lungs. So if you have a sore throat, or even if you don't, you can gargle with warm salt water. And I don't have any studies to back this up, but it does help relieve sore throats. And I believe that it may help to diminish the number of viruses multiplying in the back of your throat. So it's kind of a home remedy. The other things I recommend are wearing your glasses if you have glasses, because they can protect you from spray. If you have contacts, you really need to think about that, because you need to wash your hands before you put them in. You need to wash your hands before you touch your contacts. So contacts are a risk factor in my mind, although I haven't seen this in any of the official, but we know that we've known for years that people can get eye infections through their contacts. That is known. And the glasses can be protective. Wash your hands before putting on makeup. Don't share makeup, nasal sprays, don't share toothbrushes, don't share cigarettes, marijuana joints, or vaping pens. That's my recommendation. Again, these are just my personal thoughts about it, some things I haven't really heard in the press. This weekend, I wore a mask, and I went into Walgreens and I went into Whole Foods. I had a great experience with my mask on, and I felt good because I cough sometimes. I have asthma, and I felt good. I didn't cough, but I thought if I do cough, I don't feel anxious. And I felt good because I knew I felt safer with my mask on. And I had been talking to one of our church members. Her name is Lynn. I think her last name is Dahlberg. A little uncertain on her last name, but I spoke to her. She wants to sew masks. And what she wants to do is make cloth masks that would have 2 pieces of cloth. They'd be very breathable, they'd be attractive, and they'd be washable. And she was asking me what I thought the hospitals be interested in them, and I don't know the answer to that. But personally, I want her to make me a mask. I want to wear a mask a lot of places. Mm-hmm. And I'm wondering, just putting out there as a question, should we all be wearing a mask when we go into the market? If we had comfortable masks that we could wash, that is a barrier to those respiratory droplets. It's not a perfect barrier, but it is a barrier.
Yeah, I think that is helpful to know. We actually had a small number of masks here that we normally use for the cleaning staff and daycare workers that we actually redistributed to the rest of the staff so that they could have masks for going out to the grocery store and to the pharmacy. And I wore one myself this weekend when I was going out.
Oh, you did?
Felt a little strange because I don't normally wear a mask, but it was helpful. And I think that, the idea that you can maybe work to make home masks while people are trying to get the production of masks up is a helpful thing to know, because there's certainly a lot of crafty people.
Yeah, this church member, she wanted to do something, so she found a pattern that was on the internet for the mask, and she has a sewing machine and she can sew. She's got the material already, so she's working on masks.
That's really a good thing that I think people could know they could do at home, is to work on making a mask for themselves or for their loved ones. Yeah. So I'm wondering if you have any final thoughts you'd like to share with us.
Well, CDC, one of their messages this week was about younger people younger than 60, let's say 20 to 60. And what their message was is you're not invulnerable. You are still vulnerable to becoming infected and getting really sick. Not as vulnerable as older people, but they were pointing out how many younger people had been in ICU. And right about that time, I noticed a very sad report of a young woman in Louisiana who died of novel corona, before she could reach a hospital. Mm-hmm. So you're not invulnerable, and that's an important message. If you have not gotten a flu shot, do it now. If you're going to the doctor with symptoms, you want to be able to know that you've had a flu shot. I would say walk in the great outdoors. That's what I've been doing with my friends. Now, the governor, I think it was either the governor or the mayor, no, I think it was the mayor of New York City, was upset yesterday because there were too many people in Central Park, and so they were too close to each other. And in a situation like that, it would be nice to have a mask. Mm-hmm. Because when you go walking, you don't really necessarily know. There's a lot of people in the Houston parks out walking, but as of yesterday, it was not too crowded. I did not think it was too crowded. Connect with friends, listen to music, cook, read a good book, and discuss your thoughts and feelings with others. That's my advice. But be sure to get a flu shot if you haven't had one.
Well, thank you, Dr. Waller, for joining us.
Oh, can I say one additional thing? I think it's important to realize that there's a lot more cases of flu and even deaths from flu in Texas right now than from the coronavirus. So that is why if you go to a doctor, they will frequently ask you, have you had your flu shot? And then they want to test you for the flu. So they want to test you for what they see as the most common cause of respiratory disease in this area right now. What we're doing is we're preparing for the future. If anyone is interested in the data on the number of flu cases and deaths from flu in Texas, you go to the website of the Texas Department of Health, and it's right under the information on corona. They keep track of it routinely. It is very surprising how much flu there is out there.
Well, thank you, Dr. Waller. I found this to be very educational and helpful. And on behalf of the congregational leadership, I wanted to thank you for your early warnings that we as a church needed to take this very seriously. I think that you helped our staff really prepare for this in advance. And so we're very grateful for your leadership and service to us in this time. I imagine we'll be having you back in the near future again to talk with us about how to make sense of this situation and how best to collectively respond to this crisis that we're in. And I'd like to thank you, all our members and viewers, for joining us. In the next weeks, we'll be joined with someone to talk with us about how we can continue to participate in the census and support the census during this time of pandemic. Someone to help us talk about how to distinguish fake news from real news online, as we are moving increasingly online as a society, and many other topics. I hope that this video was helpful to you, and that if you found it to be so, you'll consider joining us for our weekly online worship service. It's posted each Sunday online at 10:30 and features a sermon by one of our ministers, readings, prayers, and music by our award-winning music director, Mark Vogel. Thank you to our staff for making this video possible. It was filmed and produced by Christian Holmes. Alma Viscara assisted with the editing. We'll see you all online soon and in person as soon as it is possible for us to gather again safely. And please remember that no matter how isolated you feel, we are all in this together. And the great truths of the moment are, we are not alone and we are connected to each other. Thank you for joining us.